Chapter 27 Simulation of the Clinical Experience. Simulated patients, mannequins, models, and computer simulations all complement experience with real patients and have a place in a training program. A key element in clinical teaching, as highlighted in the previous chapter, is the patient. Simulated patients, patient mannequins or models, and virtual patients are widely used and have been found to be of value in undergraduate education and postgraduate training to complement the students' experiences with real patients. It is essential that teachers are trained in their use to ensure that students gain maximum benefit from them. In this chapter, we look at different types of simulation, the educational strategies that need to be adopted, and the concept of the Clinical Skills Center. We will first look at the reasons for using simulators in your teaching. Reasons for simulation. Simulation is an essential rather than an optional element in the curriculum. Real patients may not always be available for clinical teaching. With changes in healthcare delivery, patient stays in hospital are now shorter, and during their stay they are occupied with investigation and treatment procedures. Patients may be less willing to have repeated exposure to students. A simulated experience can be made available to students at the most appropriate time to fit in with their learning program. This is not something you can do with real patients. With simulation, every student can receive a guaranteed and standard clinical experience. Repetitive practice is recognized as a key element in the acquisition of clinical skills. Learners can practice with the simulator until they have achieved the necessary mastery of the skill. Students are now introduced to clinical experiences earlier in many curricula and preparation on simulated patients, and simulators has been shown to prepare them for their work with real patients. Trainees can be exposed to uncommon situations or rare clinical events that they may not encounter in their routine clinical experience. The management of crisis events can be practiced and rehearsed so that students and trainees are better prepared should such events occur in real life. Airline pilots are trained in this way, and simulators enable the pilots to deal with extreme situations such as engine failures. Students can learn a procedure in a risk-free environment. Learners can make mistakes and appreciate their consequences without causing harm to patients. In some areas, it is now a requirement that a doctor demonstrates mastery of a procedure on a simulator before being approved to perform it on a patient. Uncoupling injury from learning sends a message to the public that patients are not a commodity for trading. Doctors need to be able to work as a member of the team. Simulation can address not only the acquisition of individual technical skills, but can also be used to train the learner to work in a coordinated and effective manner as a member of the team. The assessment of a learner's mastery of a clinical skill is important. Simulated patients and simulators can be used for this purpose in examinations, including high-stakes examinations, to assess the learner's mastery of a skill. Simulation can be used to provide students with a motivating and engaging learning experience. The experience can be designed to challenge the students, encourage their reflection, and provide feedback about their performance. The experience can be customized to meet the needs of the individual learner. Simulating real patients. You can simulate the real patient by using simulated patients. Individuals are trained to play the role of a patient. Simulators or mannequins. Devices or models represent the functioning of the body or part of the body, and the student interacts with the device. Virtual patients. The patient is represented in a computer simulation. A hybrid approach. A simulated patient is combined with a simulator, e.g., a catheterization model. The student catheterizes the patient, while at the same time communicating about the procedure with the simulated patient. Simulated patients. A simulated patient is a person who has undergone various levels of training to portray a role or mimic a particular physical sign for the purposes of teaching or assessment. The term standardized patient has been used when the person has been trained to play the role of a patient consistently and according to specific criteria. This may be important in the context of assessment. Students interact with simulated patients as though they are taking a history from a real patient or examining or counseling them. Uses of simulated patients include teaching and assessing history taking and communication skills. This may include counseling a patient in a difficult or sensitive area such as cancer where the use of a real patient would be inappropriate. Teaching and assessing skills in physical examination. This may include teaching and assessing intimate examination of the genitalia. Barrows and others have described how simulated patients can mimic a wide range of physical findings from an acute abdomen to spasticity. Simulated patients can be trained to portray various levels of difficulty appropriate to the stage of the learner. The simulated patient may provide a simple account of his or her history on being questioned by the learner, or the patient can be programmed to be aggressive and difficult with a confusing or muddled history. Simulated patients can be trained to represent different settings of care, including ambulatory care and general practice. A special group of simulated patients are recruited specifically to provide students with opportunities to learn the skills of male and female genital and digital rectal examination and female breast examination. Ward simulation experiences with simulated patients and ward staff have been used in Dundee Medical School to determine whether the final year medical students have acquired the level of clinical ability needed to provide high quality patient care. A significant advantage of simulated patients is that the patient can be trained to provide students with feedback about their performance. Recruiting and training simulated patients. Simulated patients may be professionally trained actors, lay volunteers, or healthcare professionals. The training of simulated patients takes time and effort, and with a new recruit, it is estimated that about 2-3 hours is required to deliver a good simulation. More detailed training may be necessary if the simulation is complex or if the simulated patient is required to assess the student's performance and provide feedback. Some critical skills units develop and maintain a bank of simulated patients. Real patients may be trained to present their history and findings for the purpose of teaching and assessment in the same way as simulated patients. Simulators. Over the last 2 decades, mannequins or models have been increasingly used to simulate real patients in the teaching of clinical and practical skills and are now part of mainstream medical education. Simulators enable learners to practice patient care in a controlled and safe environment. The level of sophistication of the mannequins and models varies. At one end of the spectrum are task trainers, which are designed to teach a low complexity procedure or skills such as breast examination, prostate examination, wound closure, catheterization, or injection techniques. At the other end of the spectrum, there are sophisticated models such as Harvey, a life-size cardiovascular patient simulator that can depict the auscultatory, tactile, and visual findings for a broad range of cardiac problems. Figure 27.1 examples of the uses of the Harvey Cardiac Simulator. The Harvey Cardiac Simulator train health professionals at different levels in their careers. Teach in the following areas: cardiology bedside skills, pathophysiology, laboratory evaluation, differential diagnosis. Try to evaluate new approaches to medical education. Test students in the following areas: cardiology bedside skills, pathophysiology, laboratory evaluation, differential diagnosis. In computer-enhanced mannequin simulators, computers are integrated into whole or part body mannequins, controlling the model's physiology and with the output shown as graphic displays on a monitor. A range of clinical scenarios can be set up. A further development is the use of computer-based haptic systems that provide learners with tactile sensations. Simulators vary in their sophistication with regard to the extent to which they mimic the real-life situation, whether they provide feedback to the learner, and the range of tasks and abnormalities that can be simulated. Some skill simulators combine haptics and virtual reality to recreate the clinical environment with visual clues available in real clinical contexts. Work is ongoing to develop virtual reality immersive simulation where the learner is able to interact as if they were in the clinical setting. There is good evidence that skills gained from practice on a simulator transfer to real patients. Isenberg et al. In a systematic review of the use of simulators identified key features that contribute to their educational effectiveness. Provision of feedback. Not surprisingly, this was identified as an important feature of simulation-based medical education. Repetitive practice. Simulators provide an opportunity for learners to engage in deliberate practice where the learner engages in focused and repeated practice with the learning outcomes clearly defined. Individualized learning. The learning on the simulator should be adapted to individual learning needs. This may mean that some students will require longer time and more practice on the simulator than others. The level of difficulty of the presentation on the simulator may also be altered to match the needs of the student. Capture of clinical variations. A wide variety of problems or conditions can be represented as related to clinical practice. Curriculum integration. Simulation-based learning is most effective when it is embedded in the curriculum and not seen as some extraordinary event. A non-threatening environment. The use of simulators is most valuable where mistakes by learners are expected and not criticized, and where these are regarded as teachable moments. Defined outcomes. The expected learning outcomes for using the simulator should be defined and related to the overall outcomes of the curriculum. Virtual patients. Virtual patients are real patients simulated electronically. They can be used in interactive computer simulations of real-life scenarios. The virtual patient has two components: information about the patient, including history, physical findings, laboratory and other investigations, and the patient's progress. The learner's interaction with the case. With technology developments, virtual patients are now more freely available on the internet or from commercial sources. In the past, the wide range of instructional design and authoring tools had a negative impact on the transferability and sharing of virtual patients between different centers and institutions. Virtual patients developed in one context could not be adapted for use in another context, and it was difficult, if not impossible, for teachers to alter a patient's presentation or investigations to fit in with their own context. There has been a significant move to more collaborative development and sharing of virtual patients with the implementation of a common standard specification. As technology advances, it is likely that we will see increasing use made of virtual patients in the training and assessment of students and trainees in all phases of their education. Uses of virtual patients. Virtual patients can be used in a number of ways. For example, to support a traditional curriculum or learning program complementing the lecture and clinical experiences as the triggers or problem presentation in a problem-based learning curriculum. To support independent learning with students individually working through the case scenarios. In collaborative learning with students working through a virtual patient scenario in pairs or in a group. Advantages of using virtual patients. Virtual patients can be accessed on demand, perhaps even more so than simulated patients and mannequin simulators, making them a very useful educational tool that offers a number of advantages. Virtual patients can be used to provide students with a wider range of patient scenarios than they may encounter in real life. The learner can take on the role of the doctor, and no harm can result from any mistakes made. A holistic approach to patient management can be encouraged. The learner can interact with the patient and engage in reflection and clinical reasoning, while at the same time recognizing professional and ethical issues. The virtual patient can highlight the integration of theory and practice and the basic sciences with clinical medicine. Virtual patients can be used for teaching and learning and for assessing learners with the learners receiving feedback. Virtual patients can demonstrate the continuity of care with the same patient located over time in different contexts, including general practice and the hospital setting. Choice of simulation. A number of factors should be taken into consideration when choosing the simulation approach to be adopted. The expected learning outcomes. Simulated patients are the obvious choice if communication skills are the expected learning outcome. Computer-based programs designed for the purpose and virtual patients also have a role to play in communication skills training. If skills in auscultation are the required learning outcome, a mannequin such as the Harvey Cardiac Simulator is appropriate. Virtual patients can contribute to decision making, problem solving, and patient management skills. The level of fidelity required. Simulators vary in how similar they are to the real situation they are designed to simulate. A high fidelity simulator may be unnecessarily complex and expensive, and a simple piece of plastic simulating a wound on the skin may be adequate to teach suturing skills. A higher fidelity simulator may be required in a high stakes examination, but may not always be necessary in a training situation. However, students tend to be more engaged with a high fidelity simulation that more closely resembles a patient. The availability of simulators. This may be a limiting factor if students do not have access to a local clinical skills center with a full range of simulators and a bank of simulated patients. It may be possible to arrange access to a nearby center. A simulated patient can be trained to meet the needs of a program, but this can be time consuming. Virtual patients that can be shared online across institutions and modified to suit a local context are now available. Clinical skills centers. There has been a growing interest in the role of clinical skills centers as a setting for teaching and learning clinical skills. These centers are usually a central area housing a range of resources, including simulators and simulated patients that can be used to assist students to master the required clinical skills. The experiences students gain in a center complement their dealings with real patients in other clinical contexts. Interprofessional education with joint learning for different healthcare professionals can successfully take place in the neutral setting of such centers.